Hi guys, welcome back to Career Screen Matters. My name is Trick, and today I'm going to be telling you a little bit about my experience having gender confirmation surgery in New Jersey. So I'm 22 right now, and I had top surgery about a month before I turned 18. So that's just something to keep in mind, that this information is going to be relevant to New Jersey in 2020 and specifically transitioning as a minor. Over the course of my transition, I've socially, medically, and legally transitioned, and I would love to share some of my experience and some advice for those who are seeking out similar results as I am. For my medical transition, I froze my eggs, utilized hormone replacement therapies, and got a double incision, sometimes referred to as DI, top surgery. This procedure is also called a double mastectomy and can have many uses, especially regarding the prevention and treatment of breast cancer. However, for our purposes, I will be talking about a more cosmetic surgery for transitioning. Um, as it was a bit more cosmetic, there were some things like lipo and some shape masculization techniques. I don't exactly know what they did, but they made it. It's not just like flat, like nothing there. There's like the male chest there, if that makes sense. They did a really good job of mimicking my chest to assist male's chest. Um, there are many different types of top surgery offered, but I wanted to be as specific as possible with the treatment I went through because I had quite a large chest, and I know DI is pretty much the only option for people with a very large chest to get top surgery. There is another method, keyhole, where they basically go into the nipple, but because of the size of my breasts, they had to go in underneath the breast tissue itself right here. So, fuck, I hope this doesn't get fucking demonetized, but oh wait, I'm wearing a crop top. Perfect. So I can cover my nipples for the internet, but look, you can see the scars. This is them about 4 years and 7 months post-op. Um, but yeah, I can insert a couple other pictures of what my scars looked like as they were healing. I also have gained weight since I had top surgery, so that also affected the way that my chest looks now because I had top surgery when I was a teenager and I'm an adult now. Like obviously my body looks different. So I will add some pictures for those who are younger who are interested in transitioning. But yeah, I just want to talk about why I felt the need to have top surgery in the first place, as well as some of the ups and downs I went through during this experience. And I really hope you guys enjoy. This video is dedicated to my friend Mary. Um, we went to high school together. She's really sweet. And one of her friends just either was going through top surgery or was about to, and she was asking me for some advice. So I wanted to, I shared early iterations of this video with both her and River. And yeah, I really hope that you guys enjoy this. I just wanted to shout them out specifically because they've been very helpful in making this video. Um, the first thing I want to get out of the way before I get into the meat and potatoes of this is that gender is really, really weird to me. For those who are new to my channel, I'm currently seeking out a diagnosis for dissociative identity disorder, or DID. However, due to my current financial situation and not having access to a private vehicle, I've been struggling with getting diagnosed for a very long time. I first started questioning that I was a system in 2023 when I met a friend of mine who experiences similar symptoms. At the time I got gender confirmation surgery, I did not know that having DID was even a possibility for me. I had known other people who identified as systems, but their symptoms were so different to mine that I just didn't consider it to be an option for me. It wasn't until I met another system who experiences similar symptoms that I started questioning it for myself. Um, However, I do think that realizing that I may be a system and seeking out that diagnosis has shaped the thoughts and feelings that come up when reflecting on my top surgery experience. And I wanted to mention it just because um, I've been wanting to make this video for a very long time, but I didn't make my YouTube channel until 2022. I was very scared of posting online, but I have had other YouTube channels where I had talked about my transition. And I feel like the retrospective of there possibly being more than one of us definitely impacts the way I see myself and my gender. So, the best way I describe myself and my gender is probably as gender fluid because I feel like the gender typically fluctuate depending on the gender of the personality that's fronting. But even if I end up not having DID and I have something else, I still probably would consider myself gender fluid. I think that my gender identity is constantly updating, constantly changing because I'm constantly updating and changing. I'm constantly growing and changing as a person. And I feel like my gender has evolved along with me. I also wanted to say that although some people may refer to me as transgender, which I don't dislike, I do prefer the term transsexual to the term transgender. I still feel like I have had the same gender I've always had, as like I'm just me gender, like, you know. I just changed my sex to better reflect that to others. I've always felt like I don't know, I just feel like a flat chest is right for me. And some people might not know, but I just happen to be someone who knew pretty well from like I reflected on it for maybe like a year or two, and I pretty much knew that's what I wanted to do most of my like high school and college experience. Well, I had top surgery before college, so most of my high school experience anyway. All right, now that you guys have a bit of a better idea of how I identify and how that affected my transition overall, I can share a little bit more about my actual experience and what it was like to go under the knife. I'm like I said, I'm currently 22 and I was almost 18 when I got my surgery. And at the time of writing the script, I am 4 years and 7 months post-op. I first started experiencing gender dysphoria during my first puberty, my girl puberty. So at age like 10 or 12, I was feeling all kinds of weird feelings about my body changing and strongly disliked my chest. There are many reasons why one may or may not want gender confirmation surgery as part of their transition. However, for me, it was something I knew I wanted for a very long time, and I had the privilege slash misfortune of having years to think about it. It took most of my family a very long time to come around to accepting me, and it still weighs heavy on our relationship to this day. After my parents decided to support my transition, I had to jump through so many hoops to actually get diagnosed with gender dysphoria as a minor. A majority of the money that I spent on my transition was seeking a diagnosis for gender dysphoria. There are two ways that doctors offer gender affirming care. One is the dysphoria diagnosis, where a gender specialist recommends gender affirming treatment to treat gender dysphoria, and informed consent, where you assess the risks with your medical team and choose an option that you think is best for you. Since I was under the age of 18, I could not legally consent to receiving gender affirming healthcare, or any healthcare for that matter, and my parents could not consent for me due to my gender being something that I can only truly define. So I had two options. I could wait till I was 18 to medically transition and go through informed consent, or I could get a letter of recommendation for treatment from a therapist who specializes in gender therapy. I had to go to 2.5 years of weekly therapy sessions, mostly consisted of having to convince them that I'm trans enough for a letter of recommendation, just to tell my other healthcare providers that I'm trans enough to get uh, the life saving care I need. And the reason why they needed that is they needed like in case I decided to detransition and got mad at the doctors for performing my surgeries, I couldn't sue them. So I don't know. I understand why it's there. It's just it was really frustrating. And also, all the people I know who have detransitioned are very grateful for the transition that they've gone through. Like, I don't know anyone personally who has detransitioned who, um, like, doesn't feel grateful for that experience and consider it part of their journey. And, like, I don't know any detransitioners who regret transitioning outside of wanting to go back, if that makes sense. But I only also know like a couple people who have detransitioned. So if any detransitioners want to share their experience in the comments below, I'd happily like to learn more about your experiences and hope you all are doing well. Um, it took literally so long to get my T letter. It took 2.5 years. Um, I felt like my therapist was very unprofessional and unhelpful. They didn't prioritize my transition as a primary therapy goal. It took me over 2.5 years of weekly therapy sessions, which mostly consisted of having to convince them that I'm trans enough for a letter of recommendation, tell my other healthcare providers that I'm trans enough to get the life-saving care I need. And while I understand it's important, um, it just it took so much out of me to have to go there every single week and be like, hey, I hate myself. I hate my body. I think that if I were able to have the entire world hate me less by looking away, that makes me seem normal, that makes me seem presentable to cis society, that I would feel overall more comfortable. And I was right too, because I mean, before I even had gender confirmation surgery, even just being on testosterone, I could walk to my car alone at night. I felt safer working the night shift as a 17-year-old trans masculine than I did my entire life before that, living as a woman. Um, I did not feel like my therapist prioritized my transition as a primary therapy goal, which I was very upfront about saying that that's what I wanted to do and that's why I was there in the first place. Um, she was concerned about my eating disorder and wanted me to receive help for my eating disorder before my transition. But a main reason I was starving myself was to make my chest appear smaller, to make my hips appear smaller, so I passed better. And I know a lot of trans people have similar experiences to that. Um, so I felt like she was trying to find a way for me to just be an anorexic cis woman instead of being a trans person who was struggling with their body image. And um, that was really hard for me. She also forgot my sister's name, um, like multiple times. And like, it's not like we're distant. Like, we were living in the same house. We have the same parents. Like, I love my sister. I see her all the fucking time. Like, you know what I mean? This was at Institute for Personal Growth in Freehold, New Jersey. I don't want to name the therapist specifically because I don't want to dox myself or her. Um, but if any other Jersey people have recommendations for other practices that evaluate minors for gender dysphoria and offer T letters and stuff like that, and has had a positive experience, please let me know in the comments below. Um, I know it's a lot harder when you're under the age of 18 and certain doctors only work with adults. So it's really hard to find someone who's there to support you through your entire transition, especially one who does endocrinology for both children and adults or adolescents and adults. I know for when I was like in middle school and high school, one of the hardest things was to find an adolescent doctor who I actually felt comfortable with. And if anyone has recommendations for adolescent doctors that take care of people under the age of 18, please comment down below as well because I did not have the best experience with that. Um, Another important thing to mention is that in the state of New Jersey, you're not allowed to have gender confirmation surgery until after being on hormone treatment for a year. And you're not allowed to start treatment on hormones until you're living as your preferred gender for a full year. Um, After I eventually got my T letter or permission from my therapist to go on testosterone, I stopped going to therapy with her and scheduled my next appointment with my endocrinologist a few weeks later. Um, like I saw her through like the necessary time that I had to see her through my transition onto testosterone, but almost like 2 months on it, I stopped seeing her and exclusively started seeing my counselor at my high school. So I did have a therapist, but it was someone who I didn't have to travel to see because I was already going to school. Like she was already there. So that was nice. I had a bit of a closer counselor who was a bit more understanding. So after I was on T for almost a year, I made that appointment to schedule my top surgery. And I actually found out about my doctor from another trans person mentioning that they had gone to him for a consultation, but that it was too expensive. But the doctor's like 20 minutes away from my parents' house by car. So I was willing to spend a little bit more money if it was a local doctor and I wouldn't have to travel out of state because I know a lot of doctors that offer those procedures to people who live in New Jersey tend to live in New York or Pennsylvania, like in Philly. And because of my insurance situation, I could not travel out of the state at that time for like health insurance and stuff. So I'm like, if I'm gonna pay out of pocket, I'd rather be 20 minutes away from my house. Um, but after um, meeting with this doctor, he also required a letter of recommendation for it because of my age. If I was over the age of 18, I would have been able to just do it then and there. But because my birthday was in August, um, if I waited till I was 18, I would have been getting going under the knife a week before I started college. So I did not like my old therapist at Institute for Post Personal Growth, but she did come in clutch. Her and Dr. John Taylor, my wonderful surgeon, they pulled some strings with the state of New Jersey and let me schedule my surgery 6 weeks before I started college, which was awesome. So 6 weeks before my first day at NJCU, which is exactly the minimum recovery time that's recommended, um, I went under the knife and I got my surgery. Um, my biggest piece of advice I can offer: take the full 8 weeks off. I would have scheduled it 2 weeks earlier if I was able to, but I do appreciate them making that exception. So I don't know if I would have been able to schedule it earlier, but I literally told them like I'll do it as early as possible, like because this was during COVID. I was laid off from my job, so I wasn't working. I was only doing DoorDash, so I wasn't really going on a set schedule. I was just working when I had free time. But part of the issue with that was I couldn't drive for 3 weeks after my surgery, and I couldn't lift over 15 pounds until 6 weeks post op, and I couldn't lift over 50 pounds until about 10 weeks post op. My surgery made it hard for me to perform basic tasks like grocery shopping and driving, which made earning money very hard for me. Additionally, I had to move all my shit to North Jersey before college because before I could actually move up here. My parents are both disabled and couldn't really help me move, so I had to physically move all of my things up here myself, come home, get surgery, and then when I moved up here, I literally just brought my laptop and my wallet. You know what? I think my laptop might have been up here. I think I literally just brought my phone and my wallet and my car. Yeah, like I didn't bring anything with me. I literally just brought myself. So that summer I spent a lot of time at the beach and just out in nature because I didn't have any of my shit to do. Um, but all of my belongings were just sitting up here in Hudson County, and I was living in Monmouth County with my parents, and I just didn't have any of my shit. Um, but I do really appreciate being able to stay with my parents at that time because they helped me with things like getting dressed, bathing, and driving me around. They drove me to all of my appointments. Um, and they also like helped me with like some financial stuff because I wasn't able to work. They would buy me like food and stuff. Um, on the plus side, I was very lucky that my surgery was during 2020, so my classes were online for fall 2020 semester. And as soon as I got my Wi-Fi set up and I got my laptop, like once I was well enough to take care of myself and take my shirt off by myself and stuff, I moved off out of my parents' house for the first time and I moved in with my grandmother. I really wouldn't have gotten through my medical transition without the help of my family and friends at the time, as well as the help of my wonderful medical team. Like I couldn't move my arms, I couldn't cook, it was hard to eat. Like it was a very difficult time. And I'm very appreciative of my family for helping me with that. Um, but yeah, I did move out of my parents' house for the first time and moved in with my grandmother when I like pretty much as soon as I turned 18. I don't remember the exact move-in date, but all of my stuff was already up here. I just needed me to be here. So, you know, sometime either right before or right after I turned 18. Um, and yeah, that's how I ended up in North Jersey. Also, I took a full ride scholarship at NJCU. I accepted the presidential scholarship. Um, so I could cash out my entire college fund that my parents had set up for me to pay for my transition. It was very, very expensive, and I need to stress that I was incredibly privileged to have financial support for that. I got the surgery on July 22nd, 2020. My surgeon was Dr. John Taylor. He's a plastic surgeon located at Allure Plastic Surgery in Red Bank, New Jersey. I don't remember the exact cost, but the overall price is probably in the 14 to 15K range. I know the anesthesiologist alone was 3K. This huge financial decision affected which college I went to, and it affected my savings account, what jobs I got. It affected my living situation. I literally shaped my entire life around this huge decision. And I feel like that's something that a lot of transphobes don't understand is that transitioning is not easy. No one wants to do this. We do it because we need to, because it's part of who we are. Like, if I hadn't transitioned, I would not be alive. Like, I don't know how people don't get that. Anyway, you cannot pay your anesthesiologist in cash. I found that out. Um, I've been working since I was 14 years old, so I had a lot of I had like $4,000 in my bank account, so I paid my anesthesiologist. I wanted to pay cash, but they told me I couldn't do that, and I had to get a bank order. But yeah, I just wanted to stress how expensive it was, how much time and planning went into it, and um, how much immense financial support I had from my family. I'm really, really privileged to have been able to afford gender confirmation surgery. I mean, my baby sister even helped me do DoorDash when I couldn't lift the bags myself. My best friend hand frosted me an ice cream cake. Another thing I didn't realize before getting cosmetic plastic surgery, you really choose everything about your surgery. Like my doctor let me choose the size and shape of my nipples. By the way, I have the same nipples I've always had, just Dr. Taylor cut down the size of the areolas. While I have absolutely no regrets about my decision to undergo gender confirmation surgery, it was definitely a very difficult decision to come to. It took a lot of contemplating, planning, and privilege. However, if the surgery is not for you or not for you right now, another option is chest binding. There are a variety of methods, with some methods being safer than others. However, I'd be lying to you if I said I've never binded unsafely. Binding unsafely can really fuck up your skin, muscles, lungs, and ribs. The Rainbow Project states that the intention of binding is to compress the soft tissue safely without compressing directly the ribs. They emphasize that the most important part of binding safely is wearing the right size binder and doing it properly to avoid damage to your ribs and chest. My personal recommendations include making sure your binder is not too small. If you're in between sizes, I recommend going up a size. Don't bind while exercising, swimming, or having sex. Don't bind for more than 8 hours at a time. Listen to your body and take it off if it hurts. Stretch before and after putting on your binder, and make sure to take binder breaks where you stretch your muscles as well. Only buy quality binders from companies designed specifically for trans and not gender nonconforming bodies. I remember really liking my binder from shapeshifters.co because it was custom to my chest and looked slash felt great. They also make pretty designs so you can have a color other than white, black, or beige. As someone who used to have quite a large rack, it sucked that I could never find cute bras or lingerie that looked good on me. And I remember feeling really attractive and happy wearing that binder. So I really recommend it. However, I haven't bought from them for several years for obvious reasons. So if anyone who currently binds has any brand recommendations or any experiences ordering from Shapeshifters in recent years, please let me know in the comments below. As an all-around addict, with Mary Jane being my drug of choice, I found it really hard to give up smoking weed for my surgery. I also found it really hard to manage my pain. I was prescribed opioids for pain, and I've been clean from hard drugs for several years now, so it felt really weird taking actual doctor-prescribed pain meds for my pain. I was lucky that my surgery did not cause a relapse, but I'd be lying if it did not cross my mind a few times. I'm very happy that my medical team worked with me to give me an amount of medication that was appropriate for my care and my body type. I would recommend taking one of the opioids immediately before getting the drains removed, however, as I was wide awake and stone cold sober for all of it, and I really wish I wasn't. Um, I swear to God, getting the drains removed was the worst part, and it was just because I was wide awake and sober. As for smoking weed, I recommend, or smoking anything, honestly, nicotine too. Um, as for smoking, it's recommended that patients quit smoking 6 to 8 weeks before and after having a double mastectomy. I was probably sober for a little over 3 months, not touching any THC products from June through September 2020. I would not have gotten through this period of time without going to the beach or hiking in the woods anytime I got a weed craving. It really sucked, but I was really brave, and I highly recommend avoiding smoking or vaping anything when preparing or recovering from any major surgery. I know it's hard, but your body deserves to heal properly. I also wanted to share my personal product recommendations for recovery. Nothing here is sponsored, and all the links to the Amazon product listings will be linked in the description below. Button-up vests are good. Also, zip-up hoodies. I didn't like the feeling of like the cold zip going over like my chest, but like if there's like plastic ones, non-metal zippers, those would be really nice to have for recovery. Also, like plastic buttons for button-up vests. I was gifted I was gifted a button-up vest by some cis allies, both my dad and my friend Abby. So shout out to them for that. I also use these men's athletic compression tank tops from Amazon in my recovery because they require you to compress it while like when you like get a wound and like you're bleeding and you have to press it down with paper towel. Think about that, except for it's your entire upper torso. Um, that's why I probably bought like 6 or 7 of these guys. They were super helpful. Um, my doctor also recommended a Strataderm scar therapy gel. I got my first bottle at the plastic surgery center, a low plastic surgery, and then I bought the rest on Amazon. Um, but yeah, I stopped using the scar gel maybe like a year after. It's recommended to do it until the scars fade, but because I really like my scars, I really don't want them to fade more. Also, I just haven't been able to afford it. It's super fucking expensive, and um, I need to pay my grocery bill, and rent is due. So I don't know what to tell you guys. Do what works best for you. but I highly recommend it in the very beginning, or at least for a year after the fact. Um, Also, since, like I mentioned, since I medically transitioned as a teenager, I've definitely put on weight since then. However, going through gender confirmation surgery has helped me been a lot more comfortable navigating my weight gain and allowing me to embrace being a mid-sized person. I've been gaining and losing the same 20 pounds my entire adult life, and I'm sick of fighting to be bigger or smaller. I just want to chill and eat yummy food and let my body look however it wants to look. I don't completely hate my moves, and although some people do not understand going through top surgery just to gain weight, my chest will still never be as big as it was pre-op. Since I no longer have milk ducts or lobules in my breasts, my chest is just fat, and I look like your average fat guy, so that's epic and cool. Like, I really don't feel the need to get any touch ups for like lipo and stuff. I know that's something that my doctor offered if I wanted to like get any lipo. For anywhere else, he offered that during like the end of my like when you go after the fact to like have the doctor check on you every few months. Like the last appointment I had with him, he said that he liked working with me and he will do any other surgeries I want done if there's any revisions or anything. And also like he offered if I wanted to get lipo or anything like that, also do that. Like, he offers those type of services and like my body reacted well to that type of thing. So I appreciate him offering that, but that is probably not something that I want to do. I just don't want any unnecessary surgeries. And for me, it felt like getting gender confirmation surgery was life saving. It was a necessary surgery for me. But absolutely no hate to people who do get other cosmetic surgeries. I think if you want to do whatever you want to your body, it's your body and live your life. You know, it's just not my thing. But also, I have tattoos all over my body, and some people don't like tattoos. So, like, whatever, everyone should look how they want to look. And I definitely think that getting surgery has helped me look the way I want to look. Um, I also wanted to wrap up this video by talking about my first time swimming shirtless in public. My dad drove me and some of my friends and I to the Manasquan Inlet to go to the beach and celebrate my 18th birthday. And feeling the ocean waves crashing onto my flat chest for the first time was probably one of the most euphoric feelings I've ever experienced. I'll be forever grateful that everyone has helped that make that happen. And I really appreciate all the support I've gotten from the trans community and from cis allies over the years. Um, all right, I think that's all I got for today's video. I'll see you guys in the next one. I love you all. Stay safe, stay warm, stay dry, be well, and thank you so much for watching Queer History Matters. Have a good one.